Hello, my name is Margaret Arnold. I am a certified ergonomic specialist, a certified safe patient handling professional, and a physical therapist working in a Michigan-based acute care hospital. The total lift bed is a unique tool that allows patients to mobilize, to weight bear and exercise earlier and more effectively than otherwise possible. Previously, when my patients can't get out of bed, it's very difficult to maximize their weight bearing, to do a lot of exercise with those patients. What I want to do today is show you how I use the total lift bed with my patients to achieve more, to be able to mobilize them earlier, and the variety of exercises that are now available to me that I can't do before. There's several key benefits to early and frequent weight bearing. Firstly, the exercise preserves bone density and prevents demineralization or osteoporosis, both of which can increase the risk of fractures and the risk of patient falls while they're in hospital. The second thing that weight bearing does, and getting a patient up early, is that it helps to manage tone. Tone is the natural resting tension in the muscle. It's what allows us to just stand at rest. And when a patient is immobile for a long period of time, or if they've had a stroke or any kind of brain damage, what can result is they can get an increase or a decrease in the tone in their muscles. What that means is either you have a leg that can't bear any weight, or you have a leg that pushes too much, there's too much tone. Both of those problems can interfere with normal ambulation, normal ability to walk, and normal return to function. So managing tone is very, very important, and weight bearing is one of the key things that can manage tone. The third huge benefit of early and frequent weight bearing is maintaining muscle strength. We know that immobility creates muscle atrophy or muscle wasting to the rate of about 1 to 3.3% muscle wasting per day. So getting them up, anything we can do to work their muscles is going to help them recover more quickly. The last thing that getting upright can do for a patient is psychological benefits. So the quicker and the more frequently we can get them up and just standing up, this allows them to feel like they are talking to their family. It allows their family members to see them at eye level. It relieves that feeling of being talked down to, and it has a tremendous effect on their psyche and their overall recovery. So what we're going to do is we're going to have our patient go up into a standing position. We're going to raise them up to as much of a tilt as he can tolerate, and then we're going to do some leg exercises and standing and squatting in that position. All right, so Jerry, I'm going to raise you up here. We're going to raise the bed up, and you'll notice here that the foot of the bed is coming up. Jerry, you're going to feel that on the bottom of your feet. What's really neat about the total lift bed is that I can tell how much weight is being transferred from my patient's body or the surface of the bed onto the footboard. And that's helpful in two ways. It helps me know how much weight he's taking on his feet, and also how much weight is being offloaded off of his bottom and his back on the bed. And so what I can do is I can look at the scale, and that tells me the percentage of weight that is being offloaded from the body onto the footboard. And on the foot plate, it actually shows how much weight is going through that foot plate at any given time. So what's really cool about that is the patient can then see the weight going through the footboard, and they can see, okay, now I'm at 40 pounds, now I'm at 50 pounds. And it's a great biofeedback tool for the patient to be able to be motivated to do a little bit more. The other thing it does is it helps me to document my progress real well. All right, so now what I'm going to do is I'm going to actually start working these muscles. And Jerry, I'm going to loosen this a little bit. We can keep the straps as tight or as loose as we want to. By keeping the straps tight, it's going to make the exercise easier and allow less freedom for the patient. By loosening the straps, it's going to allow more freedom, and it's going to make the patient work a little bit harder. What we're going to do here is we're going to do slight squats and bring the patient down. So Jerry, what I want you to do is just allow yourself to come down, down, down. Okay, now push through these legs. Push, 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 push. Okay, it hurts a little bit on that right leg. Okay, push, 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 push. And as you can see, we're getting a little bit of a squat, and then we're pushing him back up. The patient is doing as much of the work as possible. And what's neat about the total lift bed is I can work in any range. I can do a little bit, I can do a lot. I can grade how much exercise I want to do. So now we've got a higher angle and we can tilt a little bit more. And what we're doing here is we're using gravity to help make the exercise more difficult. We're progressing the difficulty level by using gravity. Patient is still safe, and I can determine how much movement I give him by how tight the straps are. So again now, Jerry, we're going to slide down, 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 come on down, 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 and push back up, push back up, push back up. Good. So we're getting lots of weight bearing through the feet here. So that's 70 pounds now is being offloaded. I'm now at 40% weight bearing. So again, this is progress and it's measurable, and I can document that. So what I'm going to do now is I'm going to put a friction reducer behind him. But the other thing, and it's very easy to put behind him now, for two reasons. We've taken the weight off, but also he can now push against me a little bit. He can give a little bit of push with his legs and arch his back a little bit. And that helps also to reduce the amount of friction going behind his back, whether it's a friction reducing device or whether we're putting a sling in to use a lift or to provide some other care for the patient. By having a little less weight on their back, that makes those tasks easier on the patient. Less shear force on their skin, and of course less chance of skin breakdown, which is really important. So I'm strapping him back in to give a little bit of support. Obviously, depending on my patient, I give as much or as little support as I need to. I'm going to loosen these again. And now what we're going to do with the friction device, the friction reducer behind him, that's going to just take a little bit of the weight off the bottom a little bit more. It's going to make him work a little bit harder. So go ahead and bend down again, come into a squat. And now I'm just going to have you hold. Okay, we're going to hold in this position here. The other thing that is really helpful with the total lift bed is with these straps, I can support the legs. I can hold my patient here. I'm putting his weight through the footboard. He's getting weight bearing. We're getting a really good stretch on the back of his ankle right here. That's really, really important for when we go to get a patient out of bed and to walk. One of the things that happens when the blankets are on their feet all their time, instead of their ankle being in this position, it kind of pushes down on their foot, and they actually get contractures of these muscles. So this is a huge advantage of the total lift bed, is that I can have my patient in this stretch position. They're weight bearing through their feet. They're getting all the benefits of being a little bit more upright. They're getting weight bearing, and I'm getting a great stretch on the ankle. I can determine how much stretch I get by how much I loosen or tighten this strap. So if I want a little bit more of a stretch, go ahead, Jerry, and come on down. I'm getting a little bit more of a stretch. He's still safe, he's not going to buckle, but he's getting a great stretch on his legs. And then when I want to work him a little bit harder again, go ahead and push up, push up, push up. If I need to give him a rest, I can just simply tighten these straps. From this position, I can do a little bit of marching. Jerry, I'm going to have you do a little bit of marching. I want you to lift up that left leg, lift it up, and back down again. And I'm going to help you with the right one. Lift, 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 lift. Good. Lift the left one up, lift, and the right one. Okay, lift. Now, one of the things that is very difficult to do and is supported by the literature and the evidence is to get high repetitions of these exercises. We know that in order for the brain to recover, in order for muscle strength to recover, we have to get a little bit more repetition, a higher intensity of exercise. That can be very difficult to do when I'm the only person at the side of the bed. So what we're going to do here is I'm going to have him go a little bit faster and try and get some more repetitions of that marching. So Jerry, I want you to go a little bit faster here. Lift up that left leg, lift it, and then the right one. And left one, come on, lift, 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 and right. Again, lift the left and right. A little bit faster, lift the left and right. And I just got about 20 repetitions in there, which would be very difficult for me to do without the total lift bed. So what I'm able to do here with the total lift bed, and this is something that is not available in any other product that I've ever seen, is because Jerry can push through the foot plate here, he's getting weight bearing on his ankles. I can get a really nice degree of ankle dorsiflexion here at the ankle, which helps to stretch out these muscles in the back of his calf. With the weight on the foot plate, what I can do is I can use that for biofeedback. So I can tell Jerry to push through his feet until he gets to a certain number. What that does is it allows me to give him instant visual feedback. He's getting weight bearing even in that sitting position, which again, even if I can't get up to standing, he can then do this periodically throughout the day himself. He could just be sitting in his bed and say, Jerry, you know what, every now and again, go ahead and just look down here and do a few of those. So go ahead, give me 4 or 5, getting this up to 100. Can you do that right now? Go ahead, push and let go. He's in his chair and he can be working and he can be weight bearing periodically on his own throughout the day. So again, another just huge benefit of the total lift bed that is just not available on any other bed that I have seen. When Jerry's strapped in all the way here, I can shift his weight side to side. So we can get weight shifting. I've got the slider behind to reduce friction. He's also in a standing position, so I can weight shift real well onto this weak leg, which is also very painful. Without the total lift bed, there's no way I would be able to do this and hold his body up and stop him from falling. So what's nice about this is he is safe, I am safe, and I can do as much or as little as I want. In order to put single leg standing, I'm not sure how much he can do on this leg, so what I'm going to do is I'm going to use the straps of the bed to support this leg until I can gauge that. So what I'm going to do here is I'm going to just take this leg out, and I'm keeping this leg supported, but I'm letting the strong leg come out. So now, what I've got here is I can lift this leg up and I can practice and work on weight bearing on this weak side, which is also the painful side. Go ahead and lift this leg up for me, Jerry. Good. And you can see there, he's weight bearing through this right leg. He's safe, he's not going anywhere. And then step this leg down again. Go ahead and do it again. Up, 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 hold it, and back down again. One more time, come on up, let this knee bend a little bit and straighten. Good, and back down again. Now what I'm going to do is I'm going to loosen the strap a little bit. That's going to allow this knee to come out into a little bit more of a squat. All right, so now we're going to make that right leg work even a little bit harder. Go ahead and lift this leg up again. Come on down and back up, and down and back up. So in this position, set it down again, I can do single leg squats in any range that I want to. So the first exercise we're going to do is working the hip flexor muscle, the muscle in front of the hip. And what we're going to do is lift this leg up. Are you ready? Come all the way up and back down. Up to touch my hand and back down. Up and touch my hand and back down. And I can do as many repetitions as I want to there. I can work till he's tired, not till I'm tired. All right, so once we've assessed that he is able to bear some weight on this leg and he can do it fairly well, at that point then we can bring in a walker, we can start doing a little bit of marching in place, even if we're not yet ready to ambulate down the hallway. So again, we can do this safely and we can assess, we've made assessment steps all the way along to make sure that we've evaluated, is he able to bear weight? Can he do all the prerequisite tasks needed to be able to walk? All right, and we may still not want to go very far, and he may be hooked up into all kinds of lines and tubes. He may even still be ventilated, but we can do all these activities and we can do them safely for him, safely for me. So he's able to put his hands on here. Go ahead and come forward just a little bit. Now you'll see here that this strap is fairly tight. It's limiting somewhat. So in order to make it a little bit harder or give him more work to do, I can loosen this strap. If I'm not real confident about how far I want to go, I can keep this strap somewhat tight, or I can take it all the way off according to how much I trust what he can do. For the purposes of the demonstration here, I'm going to show you that with the strap all the way off. And this way, he's got quite a lot of freedom here. He can put his weight through the walker. And what I'm also going to do, I've already assessed that his legs are able to take the weight in this position. So I'm actually going to undo this strap. But we're going to keep this one in place just as a little extra security. So now that he's got the walker, we're holding him here. I want you to just try and take a couple of steps, Jerry, okay? Just marching in place. All right, and if I'm on my own, working with my patient, and I don't trust that my patient is not going to fall or get dizzy or faint, or maybe it's the first time they're up, or maybe they're just heavier and it's not safe for me to move away from the bed. The advantage of doing this is huge. We're still getting weight shifting. We're getting everything that we get with gait except for striding forwards. We're getting many of the advantages. We're getting weight bearing. All these muscles are working real hard. And then when he gets tired, we can tilt back to wherever we need to be. And the foot plate comes up, so he's again supported, he's weight bearing. And then we can tilt back to where he's comfortable, where he can get a little bit of a rest. I can tilt him all the way back down if we need to. If his blood pressure is going too high or too low, we can tilt him all the way down, go to wherever he needs to be able to rest, wait till he's ready, give him a little bit of a rest, and then I can come back up again. All right, so for activities of daily living, the advantage of being able to do it in an upright position and letting the patient do it for themselves are huge. So Jerry, I'm going to have you go ahead and take your glasses off and go ahead and wash your own face. Most of the time when the patient is lying down in bed, somebody else is doing this to the patient. But typically we don't wash our face lying down in bed. We typically do it upright. And there are additional benefits in terms of brain recovery in being able to do this in an upright position. And then go ahead and put your glasses back on. So you can imagine we can wash the patient's face, we can let him brush his own teeth. He can even, do a little bit of buttoning his shirt. So go ahead and try and just undo your top button, Jerry, and then button it back up again. These are really difficult tasks to do lying down because the way our brain works, we don't typically do these lying down. So once we get in an upright position, it's much more natural. So the way our arms work is more natural. The way our muscles work is much more natural in this upright position. So there's a huge advantage to being able to do this. I can loosen the straps to make it harder. I can keep the straps really tight. So even my most deconditioned patient, they're safe in this position. I can strap them in all the way up, and even a very weak, very debilitated patient can still get the advantages of being able to do a little bit for themselves. So then if I want to work the muscle at the side of the hip, this is called the hip abductor, and this is a really important muscle for standing and walking. When we're weight bearing on one leg, so if Jerry is standing on the right leg, advancing the left leg forward, this hip muscle is what holds him up straight while he does that. And what I'm going to do here is I'm going to have you actually just bring your leg out towards me, Jerry, out and back, and out and back. And the advantage of doing this in upright is I'm getting weight bearing on this opposite leg, but I'm also getting a more difficult exercise in that he's doing it against gravity. The other thing that's advantageous about doing this in standing is that I'm not getting friction and shear behind his leg and under his heel. If I do this lying down to work that hip muscle, I've got to slide that leg across the sheet and slide the heel across the sheet. So this way I'm getting much more normal and natural movement. It's in an upright position. So even though I'm working the right leg, when I lift the right leg, this left leg, the weight-bearing leg, is also still working. I can also come out in this position, kick it out to the side, a different alternative position for working these muscles. The more we can do, the better. And what's really neat for the therapist with a total lift bed is I can work in a variety of different positions. I can work the muscles anti-gravity, I can work them gravity neutral, depending on where the bed is and how much tilt I have. And like I said before, I'm not limited by the size of the patient, the dependency of the patient, or how many people I can find to help me. I can do this safely for me and safely for him. I'm also going to work on the ankle a little bit here. So can you go up on your toes for me a little bit and back down? Up on your toes and back down. He may or may not be able to do a whole lot of this, but even just working those muscles in the back of his calf, this is a very difficult exercise for us to be able to do effectively lying down. Once I'm standing, I can actually start working these muscles. This is going to reduce my risk of deep vein thrombosis. It's going to reduce the risk of muscle wasting, and we get all those same benefits of being standing up. So the other thing we can do is lift your toes up. Again, lifting and lowering. Good. Working the muscles up the front of the shin here, again, very difficult to do effectively in a lying down position, but very important muscles for ambulation and gait. So now what I'm going to do in this position is I'm going to have you bend your knee up, Jerry. So go ahead and bend the knee, bring your heel up to your bottom. And again, you'll notice he's able to hold the handrail at the front of the bed and the top one. Go ahead and bend up and down. Now we're working his hamstring muscle. Again, another really important muscle for ambulation. Okay, and in this position here now, I want you to just tighten up your bottom muscle and kick your leg out behind you. Keep it straight and come out and back. Good. Out and back. And again, back, 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 push, push, push. And again, lift it back. Good. The more we can do, the better. And what's really neat for the therapist with a total lift bed is I can work in a variety of different positions. I can work the muscles anti-gravity, I can work them gravity neutral, depending on where the bed is and how much tilt I have. And like I said before, I'm not limited by the size of the patient, the dependency of the patient, or how many people I can find to help me. I can do this safely for me and safely for him. We can also work with a patient in prone position, but it's almost a prone standing position. And again, this gives us another position with which to work anti-gravity. And I'm going to lower the bed just a little bit here. And just enough so that it's not in an upright. And then what I'm going to have you do is turn around, just like you did to your side. Turn around. Good. And then go all the way onto your stomach. And even just for proning a patient and for positioning and bed turning, this is a great way to get the patient doing their turning and rolling rather than always having somebody do to the patient. So in this position, you can just put your hands wherever they're comfortable, okay? And we can work these muscles again in this position. Go ahead and bend your knee up behind you, Jerry. Up and back down again. Up and back down. We can work from the buttocks, so lift your whole leg back. So kick that leg back, keep the knee straight. Keep the knee straight, yep, back and down. And push it back and down. Good. So again, just different positions that we can use. This takes all the pressure off the bottom. It works these muscles. The other advantage to being able to work all these muscles without them being compressed by the body weight on the skin or on laying on the back is that we're getting better oxygenation to the muscles. So we're reducing the risk of pressure ulcers or skin breakdown. We're working all the muscles. We're reducing the demineralization of bone. We're working on strength. We're working all the body systems in the optimal position that's possible for them. All right, so now what we're going to do is we're going to work the upper body and the core. We're going to keep the lower straps in place because where we're really wanting to work is the back and the core area. And again, being able to do that in the upright position gives us additional positions and gravity situations to work. So Jerry, what I'm going to do is have you put your hands against the bed like this, and you're just going to push yourself back just a little bit. Yep, come on back. and relax. What we're getting here is extension through the lumbar spine, which is very good for a patient and helps relieve some of the back pain that they have. It also preserves that normal extension that we have when we're walking. Too often when patients come off the bed after long periods of immobility, they're in this bent over position, and it can be very difficult for them to straighten up because they lose this core strength. All right, so doing this is a way to help increase the range of motion and the strength. Now, to make this more difficult, we're going to lower the bed a little bit. The core exercises are easier to do when the bed is in most upright position. To progress these, we lower the bed a little bit. And as we get lower, go ahead and push up. You can push up against more range of motion. So the angle in here is a little higher the lower I put the bed. All right, so that helps us get lower spine, lumbar spine extension. Now, Jerry, if you bring your hands down and put them behind your back or even just by your side, are you able to lift your head up by yourself? Good. Now, in this position, without using his hands, I can actually strengthen these muscles in his lower back. So this has the added advantage when he uses his hands, he's getting a little bit more passive extension, so we're getting some range of motion, which is beneficial in the spine, but now we're getting some strength. Now for the core, what we're going to do is we're going to actually work the abdominal muscles. So Jerry, what I want you to do is I want you to reach out and touch my hand with both of your hands. All right, so reach out and touch my hand. Good, and back. And if you can see, he's actually contracting all of those abdominal muscles to do that. I can give him a target over here. Come on over here and touch my hand, and back. I can give him a target over here. So we're kicking in those oblique muscles down here, all these core abdominals, which are really helpful for gait and upright positioning. I can lower the bed to make it more difficult, so then he's going to have to sit up through a greater range of motion. And again, I want to point out that this is all safe for the patient, safe for me as a therapist. Another way to work the core is to really kick in the side muscles on their own. We've already talked about coming forward, but to work these side muscles, you can also, using either the bed or a friction reducing device behind the patient, just have them come side to side. And again, this is an exercise that they can do in any position of tilt. You can start it lying down flat, have them come up into this as much of a tilt as you want to work on as high of a position as you want. And the more they bend, the more range of motion you're getting, the more trunk strength they're getting. The other thing that you're going to get with this exercise is you're actually going to get some ventilation perfusion of the lungs. By moving the fluid and the air in the lungs, the more positional change that we can get, the more ventilation and perfusion we're going to get in those lungs. So anytime we can move the upper body, turn, roll, change positions, it's going to help with all of our body's functions, not just the strength and the range of motion. In doing side lying, we can work the oblique muscles of the abdomen by actually lifting your hips away from the bed. And this is an exercise, it's called a side plank. We do when a patient is well and is strong, but with this total lift bed, we can actually start to implement and activate these muscles at a much earlier rate in the patient's recovery. So what I'm going to have you do, Jerry, I'm going to just bring my hands under your hips here. I want you to try and just lift your hips off the bed, just a little bit, good, and back down. And lift them up and back down. And what we get here is we get weight bearing through the shoulder blade. He's actually pushing off the arm, which is pushing himself up. We're activating all the oblique muscles on the side closest to the bed. This is going to help him when he starts to come up to a sitting position. It's going to help him when he starts turning over in bed and in sitting balance and walking. So even though he's still in bed, we're starting to work all those muscles, which is going to translate into better walking, earlier walking, and quicker recovery. So the other thing in this position, we can also work in the opposite direction. So now, Jerry, you're going to push off this arm and you're actually going to lift your shoulders. The last time you were lifting your hips away, now you're lifting your shoulders away. Can you put your hand on the bed rather than your elbow? Good. And then push up. Excellent. And what I'm doing here is this is getting him ready for pushing up to sit up out of the side of the bed. Because to be able to sit up, he has to be able to push through this arm and bend up away from the bed with his upper body. So this helps me establish the necessary range of motion and the necessary strength and the necessary neural patterns. Again, we've talked a lot about neural. It's so important to get that sensory information going into the brain, which we lose when we're immobile and lying on our backs for long periods of time. And MRIs have actually shown that there's areas of the brain that go silent when we are not using them. So the more that we can do with our patients, the more sensory input that we have, the better our patients are off. The other thing that we can do with the total lift bed that is very difficult to do with just manual therapy without this technology is we can actually start to introduce some fun activities to a patient, even somebody who is fairly severely debilitated. So what we're going to do is we're going to play a little ball, and I want you just to throw and catch the ball. All right, and I can work the patient in whatever range I want to work them in. We can have them turning, we can have them twisting. I can have him reaching as much or as little as I want. I can throw the ball and make him reach a little further. We're getting all kinds of muscle activation going on here. And with doing fun activities, the patient's not necessarily thinking quite as hard about how much they're working. They're more focused on the activity. And so we can do a lot more with our patients. The other thing that makes this advantageous is I can step away from the patient to even do this activity. If I had to hold Jerry up the whole time, there's no way that we could even introduce this kind of activity. The other thing that this introduces is a much more mobile environment. It's more dynamic. Because the railing has this handle and the ability to tie some TheraBand on there, we can work the arm in lots of different ways. So go ahead, Jerry, and just bend your arm up and down like you're doing bicep curls. Good, okay, and bring it up over your head. So really any range of motion, any degree of difficulty we can do. We can also cross the midline, which is very important, especially for somebody who's got neurological damage. And if they've got a neglect on one side of the body, it's very, very important to get that sensory feedback to the brain that there are two sides to the body. What I want you to do, Jerry, is reach over and touch my hand over here. Okay, good, and again. And we can start off with arm exercises, but if I can very easily add trunk into that by having him come a little bit further. And that crossing the midline is so important and helps with that neurological recovery. And then we can also add two-armed exercises to this, where we can get both hands holding here. Same thing, but again, incorporating perhaps a weaker side or a side that has some neglect to it. So now we've attached the TheraBand to the top handle of the bed, which again gives us just different angles we can work on. Again, we can work any range, but if we want to work the shoulder a little bit higher, we can. So Jerry, in this position, just reach over, just like you did before. Touch my hand over here. Good, and back. And reach over and back. Okay, now keep your shoulder tight to the bed. Now just keep your elbow on the bed and reach down and up. Good. So now we can isolate triceps. I can work the whole body if I want to. I can isolate whichever muscle I want. So really there's no limit to what we can do, just in different positions, using different pieces of the bed, using weight bearing through the handles or using the handles as a place to provide our resistance from, giving as much or as little support. If I want to make him work even harder, I can do all these activities and I can loosen these straps so that the whole time he's working his upper body, he's also getting weight shifting and weight bearing through the legs.